3 because I feel this is a more comfortable format for me. So here we go. There once was a young woman who was an accomplished physician and surgeon. She enjoyed helping others and cherished the oath that she took in becoming a doctor, to first do no harm. However, many of the treatments that she was taught to offer had many side effects that at times were grave and serious. Furthermore, often these treatments did not get to the root cause of the problem and only treated the symptoms. This weighed heavily on her, and she began to search for another way. Not surprising, her research led her to the exploding field of gut health, and everything began to click. Even more exciting was the trend she was noticing in her own patients. They were independently using a system of gut health products called Plexus. For over 5 years, she watched them when they had been suffering from chronic migraines, embarrassing skin conditions, exhaustion of the busy working mom, which she could fully relate to that one, autoimmune diseases, IBS, and on and on. And what she witnessed was that these products that they were trying were helping, and they were getting better. She didn't know what was in these products or how this was all coming to work, but they celebrated the labs together, they celebrated the improvements in how they were feeling, and they celebrated a chance at living their life to their fullest, feeling their best. Time went on, and one day, a breast biopsy result came through the fax machine. As she stood there in her busy little office, she recalled all the times she had been standing over the years by this machine, waiting for a result for someone so that she could learn the information right away and that they wouldn't have to wait. Today, the biopsy result came back positive, and the biopsy result was hers. As she stood there, in her horror and her shock, she could only think of her family. She thought of her son, who was in 7th grade, her baby. She thought of her daughter, who was 14, just starting high school, just starting a time of her life when she would most need her mother. And so this woman went back to all that she had learned, to her ability to trust in another way, and she learned about these products, and she learned about gut health and the role of inflammation and the role of blood sugar balance and the microbiome. And she used these products as an instrumental part of her care and her support during her treatment. And now she is well. And that was critically important for me when I was looking at products to support me, and especially skincare products. Because what I was learning is that we have exposure to many different chemicals in our environment and through our personal products that actually do enter our bodies and can dysregulate our hormones, so they can act as endocrine disruptors. They have been linked to higher risk of cancer, and they are, many of them, categorized as obesogens. So some of these chemicals will get stored in fat cells and then disrupt the normal functioning of a fat cell. Fat cells are responsible for communicating with our brain in the hunger hormone, leptin and ghrelin production. And many times those pathways can be interrupted when there's a lot of obesogens and when the toxic burden